Hey ladies, let's talk about the pap smear. And today I'm going to walk you through the procedure, how I communicate with my patients, and what tools we use and how we do it. I'm Authentic Nurse Noah, family nurse practitioner, and I believe real patient care starts with listening to our patients and believing them. And here's the thing, whether you have had tons of pap smears throughout your life or whether you're going for your first one, I know that this can be an incredibly stressful procedure to get done. So I always start by letting my patients know, hey, if for any reason during this exam you're uncomfortable, you want to stop for any reason, just say so and we're done immediately. If you decide that you want a different provider, maybe you want a female provider, I'll get one for you. It's not about me, it's about your comfort. Now, I want to take you through the procedure and show you the tools that we're going to be using, and I'm going to talk you through this every step of the way. Is that okay? Okay, so first of all, I'm going to talk you through the whole exam. I will not do anything without telling you what I'm going to do first and getting your consent. So first of all, we're going to use a speculum, and I'm sure that you have heard a lot about these and how terrible they can be. I'm using the Nellakine speculum. It's the smallest speculum with a built-in light, and it has these built-in sidewall holders to make it easier to see and more comfortable for you. If for some reason this small one doesn't work, we'll go up to the next size for your anatomy, but I will always use the smallest one capable for you, okay? Most importantly, I'm going to use a lot of lubricant. I do not want this exam to cause any pain, and if at any point in time it does, I want you to tell me. This should not be a painful procedure, and you don't need to just deal with it. Now, once we get the speculum inserted, I'm going to use this brush to collect some samples from your cervix, okay? Again, this should not be painful. I'll be very careful and very gentle to make sure that I get a good sample but don't cause you any unnecessary pain, okay? Now, as we get started, I'm going to have you scooch to the end of the exam table, and as soon as you think you've scooched enough, like you're going to fall off the end, I'm going to tell you to scooch some more. So, are we good to get started? Okay, great. I'll talk you through everything. And again, don't forget to tell me to stop for any reason. Okay, I've placed a good amount of lubricant on the speculum, and you're going to feel me touch the side of the vulva, okay? All right, I'm going to go ahead and insert the speculum. Do I have your consent to do that? All right, you're going to feel some pressure, okay? Okay, and now I'm going to actually open the speculum. Okay, now I'm just going to look and make sure that everything looks okay. I can see the cervix, and I can see the opening. Okay, and now I'm going to insert that brush like we talked about and get the collection. You might feel a little pinch here, but you shouldn't feel any pain. Is that okay? All right, great. Okay, I've got the sample. Okay, I'm going to close the speculum, and I'm going to remove it. Okay, we've collected the sample and got everything that we need. I want you to go ahead and get dressed. I'll be back in just a couple minutes. Okay, great. So I just want to tell you, you did terrific. Did I cause you any pain? Were there any issues? Is there anything that I can do better next time? No? Okay, that's very important to me. And if there is, please let me know. Now, that sample is going to get sent away, and they're going to check those cells for any, signs of like precancerous cervical cells, and things like that. So if those results come back and there are any concerns, I will let you know. Otherwise, you're going to be good for like the next 3 years. So please, if anything comes up, let me know. You may have a little bit of spotting right now immediately afterwards, but I think you're going to be okay. If anything comes up, don't hesitate to reach out, and I will be in touch with you. Thanks. And finally, if you're still here, it's very important to remember that patients have lived different experiences, different traumas, be it medically, be it privately. And it's important to keep those considerations into account. Talk your patients through what's going on. Always get their consent. And finally, remember that it is about them. It's not about you. If they want a different provider, if they ask you to stop, right, then that's what they deserve. And for some patients, it might be appropriate to prescribe them something for anxiety to take 30 minutes or so before the exam. If you do this, make sure that they have a driver and make sure that they don't have any other contraindications. Remember to put your patients first, communicate clearly, and offer them the kindness and respect of listening and believing them. Love you.